come with as well a shift. They shift away from pain. Can you see those patients? So the patient that we're going to be talking about is in your books. Okay, and it's page starting in 109. So it's shift correction, okay? We're going to work this again. So we're going to do the shift correction. You all found it? So let's say the patient's got right lateral shift, okay? So if I say right lateral shift, that means shoulders are shifted to the right. So right shoulder is shifted that way. So that means the pain is on the left side. So if I've got right lateral shift, that means pain is usually on the contralateral side. And it's usually discogenic. It's due to the disc irritation. They sometimes shift away, but also a bit flex as well. They don't even unable to extend, it's too painful. So they come in, it's almost in a bit of flex position and shift it away from pain. Okay? So if it's right lateral shift, that means the pain is on the left side. And this is a patient that probably on day one, I would not lie him down because once I put him down, he might not be able to get up. And probably had those situations. Now we treat patient, maybe doing PAs, and they said, I can't get up. It's too much. Like we almost need to help them to get up off the bed. So in this really inflammatory state, very acute state, so we start treating in standing, okay? The shift correction will be first, as a first step, shift correction in standing. So I'm going to show you this first. Once you corrected shift in standing, we're going to go next step. You've got all the photos here. We're going to go into lateral flexion in side lying. So the next technique we're going to do is lateral flexion in side lying, and I'll show which way and how to do it. Okay. After that, what we're going to do is the next page. The next technique is called side glide combined with passive repeated extension. Okay, so side glide. With passive repeated extension. Okay. After that, we're going to do a rotation technique in prone as a progression, rotation technique in prone. In prone. And after that, again, we're going back into standing, and we're going to do rotation with side flexion, mobilization with movement, rotation with side flexion, or mobilization with movement in standing. So that would be sort of the last progression of that. And basically how quickly we get there, it depends on each individual, isn't it? So we might not get there in a week from all this. Or even sometimes in 2 weeks we might not get all of this. Because remember, if you remember there, how long does it take for acute back pain to recover, like according to the research? From somewhere from 2 to 4 weeks, okay? So somewhere in between. So some people will recover a bit quicker, Some people a bit probably longer, so you're giving yourself around 2 to 4 weeks, okay, for that acute back sprain. And initially, I might just do the side shift correction in standing, and mind you, that's it what I'm going to do for this patient. I might put the tape, give them a good advice, make sure they do the exercise at home. Maybe also they need some anti-inflammatories, like Voltaren, just to kind of reduce that inflammation, because these corrections, especially if you're setting, not going to be pain-free. They're going to be painful, but you don't want the patient to keep walking like this for a week. You kind of want to correct that shift. So the first thing what you want to do is correct the shift. Once the shift is corrected, the second movement or next movement that we want to correct is extension. Because extension is going to be limited also and painful. Once we correct the extension, okay, then we want to treat same side flexion, because that's compressive pattern, isn't it, for the disc? So this is going to be probably later. And once that improves, later, then we can go and improve flexion, because with this shift, all movement is going to be painful and limited. So we're going to go step by step process. Because remember, to have a healthy spine, we need all the movements, and side flexion, and extension, and flexion. But how we get there, again, depends on the severity of the symptoms, how patient can tolerate the mobilization and exercise. Okay? All right, guys, so let's have a look at this process, how we go about this.